Does your baby have a flat head? Maybe it's flat at the back or flat at the side. My name's Ruth, I'm a health visitor. Let's get into this. Now, as long as you haven't been told otherwise by a paediatrician that there's a diagnosis there, 1 in 5 babies will experience flat head syndrome. Now, the correct name of this is plagiocephaly at the back, and then at the side is brachycephaly. I think I'm pronouncing that right. I'll explain why this happens and things we can do to help get rid of the flat head, but I just want to let you know this is very, very normal. So why does this happen? When babies are born, their skulls are very, very soft, and hence they have a soft spot. The skulls can move around. Ultimately, this is so they can be pushed out of the birth canal and the head can elongate and then go back to its normal size. A couple of other things that can also cause this is the way they were laying in the womb. They've either had too much time laying on the floor or laying in their crib or, laying on their back. Premature babies have softer skulls, so they can be more prone to it. And then also neck muscle tightness can also cause this, which is something that can happen throughout when they're in the uterus as well. In most cases, there's not anything to worry about here. You don't need to pay £1,000 for a helmet. There's actually very minimal evidence this helps. It usually improves itself and it doesn't cause pain. Things you can do is whenever your baby is awake, having them upright as much as possible, wearing them in a sling, doing tummy time. Remember, this is tummy time with them here on your chest, with just where they're lifting their heads up a little bit more. If they have a side preference to feed because that side of the flat head is the side that's more comfortable leaning that way, try feeding on the other way. Same with formula feeding, you can feed them in the other position. Likewise, if they have a favoured position when they're laying down, put shiny toys on the other side, so they have to work a little bit harder to keep starting to practice that moving that neck muscle. If you think they are really struggling to move their head because of tightness, let your health visitor know or GP know, and they can refer you to physiotherapy. Ultimately, reducing the amount of time they are laying on a flat surface, which at night time we always hope, and nap time they of course usually are laying down flat, which is why up in a sling can be better. You have more control of moving their head in which position it's laying in then. Helmets are not actually recommended by the NHS. Like I said previously, there's actually very minimal evidence that they work, and they're about £2,000 per helmet. I said one earlier, but I've just looked it up and it is £2,000. The helmet needs to change very, very frequently because the baby's head grows. They can be hot, they can be uncomfortable, they can be itchy. So in my opinion, you're just better off trying to do a little bit more tummy time. It will usually sort itself out by the age of 1 to 2 years. So you have got time, and don't forget, for a large portion of their life from 6 to 7 months plus, they will be sitting up more. They will be having their head held up high more. So it does tend to sort itself out. It's very common and you're not doing anything wrong. Just keep your baby upright a little bit longer, as much as you can. If you have any questions, please put them in the comments.